The feet first, head resting on the legs.
Dr. Lacey Fowler grew up on a farm in Innisfree. She has been a vet for 6 years and works at an all-female vet clinic in Viking.
Our practice is owned by Dr. Deborah Carroll, and then we have Dr. Prue Maxwell and Dr. Lauren Reiser. So we have all-female vet staff and all-female support staff as well.
Fowler was speaking at the Rural Women Conference on Calving 101, specifically about assisting a cow in the birthing process to ensure the best outcome.
There's so many different ways to deliver a calf, and definitely I think the most important kind of trick or principle is being able to judge when a calf is too big to fit through the pelvis, and just knowing the limitations of the cow herself.
Fowler points out that the cow's pelvis is taller than it is wide.
Being able to help assist that calf get through that pelvis in the least harmful way possible. So whether it's turning that calf to help get the hips out, whether it is knowing that when a calf is backwards, you can pinch off the umbilicus on the pelvis. It's knowing kind of the limitations of the animal and the process so that you can have a good outcome.
Once the calf is born, the other matter is the suckle reflex. Calves need to get colostrum from their moms in the first few hours to build up their immune system, or they risk getting diseases like scours.
If a calf lacks the ability to suck on your fingers, then it's not likely to get colostrum on its own. It's not likely to have the natural reflexes in place.
Fowler says if a calf doesn't have the suckle reflex, then it's 41 times less likely to be able to get colostrum on its own. Without it, a calf is 5 times more likely to die before weaning in the fall. Farmers will have to get it in orally, as the area of the stomach that receives it closes after about the first 4 to 6 hours of life.
The colostrum contains all the antibodies needed to give that calf immunity for its first 3 months of life.
Gerard Lampow, Primetime Local News.